for taking the time to speak with us today.
Yeah.
How are you doing?
I'm good.
Nice. Well, we recently came across your story, and we were super intrigued, and we know nursing right now is quite essential, to say the least, and that you are on the front lines of what we're all dealing with now with the coronavirus. So we wanted to kind of get to know you a little better and hear your story, and just learn a little bit more about how you got into nursing and where your journey started.
Yeah. So I was kind of told my whole life that I couldn't be a nurse. Like, I wasn't going to be able to do it with my disability, but it's what I really wanted to do. So I just decided to do it anyway. And now I work in an ICU and love it, and don't feel like my disability really gets in the way too much. Sometimes it makes things harder for me, or it takes me a little bit longer. Other than that, it's not really that difficult. And right now I'm in school for my nurse practitioner, because I know I won't be able to do it forever. So it kind of gives me a way to still do what I love.
Yeah, no, that totally makes sense. You don't want to burn yourself out, because I'm sure it's a very demanding job. Tell us a little bit about when you were first diagnosed, and do you know what type you have and what your symptoms have been like?
Yeah, so I have CMT 1A, which is what my family has. So it wasn't really a surprise to my parents. My dad has it and his mom has it. There's 3 of us siblings. 2 of us have it, and my brother doesn't.
Okay.
Symptoms-wise, I was pretty normal until about 8 years old. I played soccer and danced, and that's when things started getting a little bit harder and a little bit more painful for me. And then nothing really changed much again until about college. College is more when like the nerve pain and I really started to feel my muscles not working very well. Through college, I started talking about braces and surgeries and stuff like that, because I was really having more of an impact on my life. So I had 5 surgeries, and for a period of time I wore braces. I still have like AFO braces if I need them, but currently I'm not having to wear them, which is great.
Okay. So, wow, 5 surgeries during your time between college and now?
Mm-hmm.
Wow.
I just had my last one in January of this year.
So how has that affected, or has it all affected nursing, or has it improved? What's been the effect?
I think it's greatly improved things for me. I had a little bit of a complication, blood flow on my left foot. So I got a lot of pressure ulcers and have kind of been dealing with that for 4 years. But this past surgery in January has fixed that completely. So walking, I actually feel like I can walk without my braces, which is amazing. And the pain has gone from probably like a 7 or 8 every day to like a 3 or 4, which is honestly amazing.
Yeah, big difference. So were they reconstructive surgeries? Were they on your just feet, or were they on your hands as well? What kind of surgeries?
So feet, I got both feet done, and they were full reconstruction. So I had a medhead osteotomy, a calcaneal osteotomy, got a couple tendon transfers in my feet. I had my Achilles tendon lengthened, and then I had my toes, all of my toes were hand toes.
Very common.
the tendon underneath the toes slipped and then pins put in for 6 weeks.
Wow.
And then there was a rod in both of my big toes until recently when that was causing a problem on my left. So they took that out in January, fused my big toe up at a 15-degree angle so it wasn't having any more pressure.
Okay. It's I'm sure any of those rehabs were not easy. I've been through one surgery and I know how tough that is. So I can't imagine 6 surgeries, but I'm glad to see that they were helpful and that they're letting you do your type of work now. And so going back to nursing, are you full-time in ICU, or have you always been in ICU? And what are some of your challenges, and what are some of the advantages of having CMT?
So I work in medical ICU. We kind of get everything, and that's where I worked for 2 years. I graduated nursing school. So some things that are hard, like if somebody needs something quickly, normally I just pass it off. You know, somebody else goes and gets something.
Okay. So like walking quickly to grab something. Okay.
Yeah. Opening things is generally okay because most of our meds are just like a pop cap.
Okay.
But sometimes opening things is difficult with my hands. Some of the advantages of working in an ICU is I only have 1 patients.
Okay.
It's not super, like, I don't feel like I'm running around the whole unit all day.
Right.
And I can spend more time pretty close location. And something I think that has benefited me being a nurse with CMT is my empathy. Like when patients are struggling through a hard time, something I really feel like I can help encourage them and just say, like, I know it hurts. I know this is hard. So that's definitely been an advantage.
Yeah, I'm sure you can relate to a lot of your patients. Was there a time during your journey through nursing school and even now that you were maybe discriminated against or you had to advocate for yourself? Was there a time where you doubted your ability to, continue with this kind of career because of your CMT? What's that balance been like for you?
So I guess it was my sophomore year of college was right after my surgery.
Okay.
Oh no, it was my junior year. It was right after my first surgery. I had a lot of blood flow issues and I had a lot of issues with ulcers. So I was in a cast and a boot for much longer than expected. And when I went to go do a clinical, I was just told that you're not allowed, you can't go in a boot, it's unsafe. And so I just told them that I would wear a shoe with a brace with my AFO, and that would be a problem. And they still said that it was not okay, and I could do that for the safety of patients. And so thankfully, one of the professors at the university worked with me because she also has a disability, and we were able to work through the disability services at the college. Ended up going to like fairs and having to say, like, look, there's this thing called the Americans with Disabilities Act, and you're not doing that. And
right.
you have to either allow me to go or provide a reasonable accommodation. And after we went through all of those avenues, finally they did let me go to clinicals.
Okay. And what about as far as like being hired at a hospital? We've heard some stories of a few nurses, even in wheelchairs, who had gone on, close to 100 interviews for a job with, to be on the front lines and in the IC unit. Was your disability something that you disclosed to your employers, or do you find that they are accommodating and understanding of you having CMT? What's that been like for you?
Personally, I chose not to disclose it when I was like doing job applications, interviewing. I didn't feel like it was the side of me that they needed to judge before they met me and before they saw my abilities, because I felt like that was something that could impede me in getting a job.
Right.
Just kind of reading symptoms on a Google search, because a lot of people still don't know about CMT and how it affects people differently.
Right.
So I chose not to disclose it, and still there's a fair amount of people that I work with that don't know.
Okay. And as far as like your team members and what's that been like? Do you feel like you have a lot of support at work?
Yeah, I definitely feel like I have a lot of support. There was a boy about 3 months ago that we had in our ICU who had muscular dystrophy. And I just expressed like that it was going to be difficult for me to care for him because of his critical illness, and that it would just be hard for me to be in the room and not get very emotionally attached to him. And so they were able to work around the assignments and not assign me to that patient just for my benefit emotionally.
So, I mean, as far as like being on your feet all day, is that difficult as well? As you said, you don't wear braces. Do you have to take breaks during the day, or what do you?
Some days definitely harder than others. I do wear compression socks because of my feet swell pretty good.
Okay.
But I take breaks when needed if possible. Some days it's not. And I'm able to put my feet up when I can. But it hasn't been terrible. There are some days that are definitely rough, and there's some days that I come home and my husband has to come out to the car and help me walk inside. Because if I work for 12 hours and I'm on my feet and moving for so long, and then I sit down and drive home for an hour, by the time that I'm ready to get out of the car, everything is just tight.
Yeah, I've been there. The fatigue, I'm sure, is like sets in during that drive home.
Yeah, so I only work 3 days a week.
Okay.
Which is full time for a nurse for 12-hour shifts. Recently, I've been working 5 days a week with everything going on, which has been a lot. Thankfully, I've been able to do lighter things some days and not take care of patients and kind of help around the unit, which has been really helpful. But this week, I just decided to take a break and only work by 3.
Okay. Well, that's nice that you have that option. I mean, what's it been like for the past, I guess we're going on 2 months since COVID started? What's your, what does your day look like? Has it been a huge surge in patients for you? And what's your take on the situation and the virus and how things are going?
There's been a pretty good ebb and flow. Like, it's either really quiet or we're getting like admission after admission after admission. And sometimes patients will be fine and then they're just not. So we have a 24-bed unit. 8 of our beds are on hallway, and so there are clean rooms, so they are not designated for COVID patients.
Okay.
The other side of the unit, the rest of the 24 beds, are our COVID patient rooms. So basically we are told to go in there as little as possible, only like when the patient needs us. But it's not like a med surg floor. Our patients are critically ill and on ventilators, sedated, and sometimes they're on like blood pressure medications and stuff like that. So they need us pretty frequently. So we go in as needed. It's a little difficult to put on and take off the foot covers just because I don't have the greatest balance.
Right.
But I figured it out. And I just bleach my shoes just to make sure.
Okay.
But that's been the hardest thing, just with the whole COVID thing. I wear a PAPR because I feel like I don't breathe very well with the N95, which I don't think anybody does.
Okay.
But it makes it a lot harder for me to breathe in the N95. So I wear a full-on, like, over-the-head respirator.
Okay. Wow. And that's just for medical use, I'm assuming. That's.
Yeah. So
okay.
anytime I go in the room, that's what I wear.
Gotcha. Okay. And are there like any extra precautions that you're taking because of the CMT? You know, like you said, as far as respiration, I'm assuming, you know, like your family members and isolating from them. How's that been?
So I've been in the same house as my husband, and it's just the two of us that live here. But the hospital, thankfully, is giving us scrubs to wear while at work. So I just wear my own clothes to the hospital. I change in the locker room, and then I'm able to get rid of my dirty scrubs before I leave. Before that, I would change in our laundry room and get rid of my scrubs there.
Right.
And I am been bleaching my shoes before I even get in my car, and then after I get out of my car before I come into my house.
Right. And where are you located?
In North Carolina.
North Carolina. Okay. Excellent. Yeah, I mean, it's pretty wild. I know a lot of, you know, we've gotten a lot of messages from people who have maybe been contemplating nursing school or pursuing a career in the medical field. Is there any advice you'd give them?
I love it. I feel like if it's your passion, then don't let anybody tell you can't do it. There are so many different types of nursing. You just have to make through nursing school, and then you can, like, you could do wound care, which is not, you know, super intensive. You can do clinic work. You can do research. You can do phone nursing. So there are so many things that you can do with a career. Nursing school is just the hardest part, in my opinion, because it's very cut and dry. Like, you have to meet certain criteria.
Right.
But if you work through those things and are upfront kind of about, well, this is what I can do and this is what I can do, and I'm willing to make the accommodation or extra or do other things, then really I feel like it's not an issue.
Right. And I mean, hopefully the needle keeps moving in the direction of, you know, inclusivity and just making sure that there's an even playing field as far as education and the access to education and what accommodations are acceptable in the workplace and ones, you know. So it's very encouraging to hear your story, because we don't really hear that often about, you know, it's such a demanding line of work, especially now, and it's so important. And I just want to thank you on behalf of the entire community for, you know, your selflessness and your service, and the work you do is really just so important right now. So we really appreciate it.
Of course.
Yeah, thank you so much. So if you have any more questions for Anne or myself, please free to send us or send a DM to CMT We Got This in our Instagram, and we'll keep you posted. Thank you so much, Anne.
Thanks.
We appreciate it. All right, bye everybody. Take care.